Good afternoon, everybody. This is Congressman Scott Perry. Welcome to our most recent COVID-19 town hall, and I thank you for taking the time to join this afternoon. This call is just the latest in a series of events we've held for the constituents of Pennsylvania's 10th District to stay up to date on COVID-19, the outbreak, and our community's response. On the call today, we'll be discussing the ongoing medical risk of COVID-19, and just for an added twist, food safety and the best practices when visiting your local grocery store. I am privileged to have an outstanding leaders in our community join with me on the call this afternoon. Today, I'm joined by Dr. Mark Godecker of WellSpan Health and Nicholas Bertram of the Giant Company. Now, if you're not familiar, Dr. Godecker is the Vice President and Regional Medical Director of the Central Region at the WellSpan Medical Group. Nicholas Bertram is the President of the Giant Food Company, or the Giant Company, which operates Giant Food Stores Martin's, Giant Heirloom Market, Giant Direct, and Martin's Direct Grocery Stores. We're honored to have them with us today, and we would like to dive right into questions. My first question is going to be to Dr. Godecker. How about we start with you, Doc? Our healthcare providers are on the front lines of the battle against COVID-19, and our community owes these heroes, I think, a tremendous thank you. I guess a question maybe for all of this is, what can our community do to show each one of our gratitude, support for our healthcare workers, and support their current needs?
Thank you, Congressman Perry, and thank you for inviting me to join this conversation with your constituents. I also want to thank you for your recent support of the federal COVID-19 relief bills. That did mean quite a lot to us. Our physicians, our nurses, our leaders, and our staff of WellSpan Health, we are immensely grateful for the ongoing support of our community members, of our small businesses, of our nonprofits, organizations, and our other partners during this pandemic. WellSpan's actively seeking donations of supplies, materials, blood services, and other needs in response to the pandemic. If you want to learn more about how to help us out with that during this time, you can visit wellspan.org/coronavirus and click on the I Want to Help button. We also have a coronavirus information hotline that you can access. It's 855-851-3641, and if you select option 4, they will be able to help give you more information. But we really appreciate everything that the community has done and the outpouring of support that we have received.
Hey, thanks, Dr. Godecker. And before I ask Nicholas a question, I did forget to tell everybody, if you do have a question for me, Dr. Godecker, or Nicholas, please dial or hit *3 to be placed into the queue. It'd be *3 if you have a question. And I would say this as well, Dr. Godecker. I mean, just to follow up on how we can show our appreciation, I think one of the things we can do as best as we can is follow the guidance regarding the distancing, regarding the hand washing, and so on and so forth, so that we don't put these folks that have pledged their lives in a way in service to their community in peril by getting ourselves in trouble and then having to report to the doctor or medical professionals. I would think that would be like one of the simple things that each one would ask us if you just follow the guidelines. It helps them out, and it helps all of us out. I would think that would be right, wouldn't it?
Yeah, that's probably the biggest thing that you can do when you bring that up. Following the guidelines, the social distancing is in place for a reason. We don't want to overwhelm our hospitals and our healthcare system with patients that are seriously ill, and the way we can do that is by slowing the spread of the disease, by keeping that social distancing, washing hands, making sure that you're avoiding touching your face, your nose, your eyes. All of those things are very, very important.
Well, thank you for that. And again, dial *3 if you have a question. Now I'd like to go to Nicholas, who, again, Giant and Giant Food Stores, Martin's Direct, Giant Heirloom Market, etc. Nicholas, many of our neighbors we're visiting our local Giant store to buy groceries for ourselves, for our own families, for our loved ones. Can you share the latest steps on how your company has what the steps your company has taken to ensure the stores are safe, are clean, are stocked, and are ready to be shopped? And I hope I can just call you Nick.
Yeah, you can call me Nick. It's and thanks for the
Nick.
question, and to be with you, Congressman, and to everybody on the line. We've changed quite a bit as a company over the last several weeks and tried to respond to new information as it comes in, and just our promise to our neighbors and community, and even to my teammates. Giant is second largest private employer in the Commonwealth, and so there's about 30,000 people that I'm passionate about protecting, just as I want to protect the 3.5 million households that shop in a store with us or online. And so we have done a lot of things, such as changing the hours and restricting, when people can be inside of the store as a customer and as a vendor, in order to give us more time to do deep cleaning and enhanced sanitation practices that we have, really put out there to make sure that everything is just as safe as possible for anybody who's inside of a store. We've also introduced social distancing techniques inside of the stores. There is now one directional aisle shoppage. So in other words, you can only go up aisle 3 and down aisle 4. You can't pass anybody. We have one way in and one way out to our stores now, in our dual entrance stores, to try and keep traffic. And we actually only open every other register now, so that there can be distance between. And then we installed plexiglass sneeze guards several weeks ago, just as another way to protect our cashiers, but also, just to keep everyone safe. So those are some of the examples. And then we've also rolled out quite a bit of technology to try and help out. So we have a couple of interesting tools like Scan It, which is where you can use your smartphone as your own cash register, and you don't actually have to touch anything. 6 of our stores right here in the district actually have Scan It Express, where you can attach your credit card to it and you can just walk straight through like a VIP line. For our pharmacy, instead of having to hand off the paper, you can actually use our pharmacy app now, so you don't have to touch anything. You can do automatic refills. And then in our delis, we have a deli order head app and a kiosk in store, again, just to try and take as many touch points out of the process as possible, so that we can still be what we mean to the community, but at the same time protect our team and then protect everybody else that's inside of there. So those are some of the things that we've done. We're lucky or clever maybe to have started e-commerce a long time ago. So Giant Direct is a really important part of our company, and unfortunately all of our slots are sold out, either for pickup at curbside or delivery. And we're hiring rapidly. We've hired about 2,000 people since this whole thing began, many of those supporting Giant Direct, so that we can have even more order slots for those who choose to do that. There's a lot more than that, but those are probably some of the more visible ones to your constituents and to our customers.
Hey, Nick, just while everybody's dialing *3 to ask a question, let me ask you one further one that I think is on my mind, and I think is probably on the mind of a lot of constituents. When we go to the store, certain things are hard to come by, right? And we think that over time that they'll be replenished, and but on occasion you will go back after a week or two, and it seems to be the circumstance remains the same or pretty close to the same. Can you talk about supply chain and how you're managing it, and how we should manage ourselves, our expectations, those type of things? Because I think that's a big issue for a lot of folks.
Yeah, and it is for me personally as well. When you have a snowstorm or a hurricane in one part of the country, the U.S. supply chain, which is quite strong, can flex and fill in and recover pretty quickly. But this is the equivalent of having a blizzard that's, all 50 states and indeed global, that lasts for, multiple weeks. And so even though the supply chain is really strong and growers and manufacturers are all ramping up production and do a lot of great things, that initial onslaught of what I call panic buying, where people just really didn't know and they were, scared like many of us are, and so bought maybe a bit irrationally at the beginning, and then that kind of fed into the continuation of panic buying. It definitely pulled a lot out of the front side of the supply chain. And as things are coming back in, different commodities, different channels, different temperatures, It's just taking a lot longer to see the difference in stores. Now, there are some areas where, we're lucky because, agriculture is important in Pennsylvania. So when you look at dairy and milk and those products, came back really quickly, right? Fresh produce, fresh fruit and veg also came back really quickly. And some of the other areas such as, the delicatessen, the meats, the bakery, and all of those things. Frozen has been a real challenge because a lot of people went after frozen. That's not all the way back yet, but I know that it's coming back a little bit more every day. And then when you just go up to traditional grocery aisles, the one that stands out the most, of course, is paper goods. And that's an interesting story and could probably be, a really long conversation, but suffice it to say that manufacturers across the country are changing the way that they're producing. They're actually cutting out, specific scents or pack sizes so that they can just produce the main pack sizes and then sending those out in large pallet quantities instead of the way that they used to send it. And this is not just for Giant, this is for the whole of the retail industry to try and get, closer to what the consumer demand is, which is still unusually high. So the way that everybody can help out right now, first of all, is to limit the number of occasions to the stores. Only go by yourself unless you absolutely have to have somebody else with you. And then just consider, leaving more for all. This is not really a time to stock up the pantry because the supply chain is strong and a lot of product is really coming in. It's flowing every single day. Our receipts are higher than what our sales are right now. It's just taking a while to get in there. So leave more for all. Just take what you need to get through the next week or 2 weeks for you and your family, and don't try to really stock up just because, you like that one flavor of soup and you see a lot in there, because somebody else may be coming in later and they actually need that.
So you're telling us if we can just refrain a little bit, it'll be there the next time we go, and the next time then too. I think that's what I'm hearing. Okay, Laura, if you're on the line, can you queue up our first question from our listening audience?
Yes, sir. Our first question is from Barbara G.
Hi, Barbara. Go ahead.
Hi. My question is, I have literally been staying in the house for 2 weeks because I'm at high risk. But everyone in my family is at high risk, and someone has to go to the grocery store. So how safe am I with them going and bringing it back to me?
Nick, that's probably right up your alley there.
Yeah, first of all, thanks for the question, and I hope you and your family stay safe and healthy. We've done a lot to make sure that our grocery stores are clean, and we have a strong protocol anyway. I mean, our reputation, we've spent 97 years building it, and we don't want to mess it up by not taking the right steps to keep a store clean. But I would say that if you come in and if you exercise social distancing and you utilize the contact options, and maybe not you, but the person in your family who's coming in to shop, they can also come in during our vulnerable hour from 6 a.m. to 7 a.m. We're only open for individuals who are, either senior in age or have some other medical condition, which makes them vulnerable. That would be the best time. That would be when we've just done our overnight cleaning and a really good time to do that. Or if you're in one of our delivery zones, we can just deliver it to you. And so there's a lot of options to make sure and, keep you as safe as possible, but also keep your family fed.
Hey, Dr. Godecker, do you want to add on some things to that?
Yeah, I definitely think that there are some things that your family members can do to try to keep you safe and keep themselves safe. I think one of the recommendations now that we are seeing more and more people that are wearing masks, and they might not be surgical masks, but you can use homemade masks or bandanas, things such as that. It will keep you from spreading or other people from spreading the virus. But it also does an interesting thing. It keeps your hands away from your face. I think the other thing is that going back to that good hand washing. So after you come back from the store and you're putting away the groceries and the items, making sure that you clean your hands well, that you don't bring any of the or spread any of the virus there in that situation. So I think those are the big things that I would recommend.
Hey, Nick, if Barbara wants to figure out which option is best for her of all the different options that your stores provide, how should she go about doing that? Can she do that from home?
Absolutely, yeah. GiantFoodStores.com has all of those different options on there, and also the way to order there or to call one of us if we can be of help.
Great, thank you. All right, Barbara, I hope that answers your question. Laura, do we have another question?
Our next question is from Ann V.
Go ahead, Ann. Good to talk to you.
Hi there. How are you?
I am well. I hope you are too.
Okay, and I want to thank you for having this. It's very helpful. My question was, outside of age and underlying medical conditions, what seems to be the difference between somebody getting a mild case and another person ending up on a ventilator?
Wow. Okay, Dr. Godecker.
Yes, I will take that. And Ann, that's a great question. About 80% of people will get mild cases. They'll have symptoms for about a week or less, and then they will be fine. So that's the important thing to realize, is that most people do not have problems. You identified the two biggest risk factors. They are age, and they are underlying medical conditions such as asthma and diabetes. Any type of lung disease is a big one that contributes to this. And I think the key is in those situations is that if you are in one of those groups or you have those conditions, that you need to be very careful, extra careful with not only social distancing, but having people that could potentially come into your house and bring that virus in, and they might even be asymptomatic or not having symptoms. So just being careful. I know I was some people sharing stories about, I'll have friends and family over, and I think taking advantage of all of the new types of media that we have, such as FaceTiming and things like that, are great ways to get around this, so you can still stay social and interact with family. But yes, so the age and underlying medical conditions are the two main things that could lead to the more serious infections.
Well, thank you. And thank you, Ann, for the question. I think it's probably a question on a lot of people's minds. Laura, is there another question?
Our next question is from Pat A.
Go ahead, Pat.
Hi. I just wanted, first of all, to thank you. And secondly, this may or may not be particular, but the thing of it is the $1,200 that we're supposed to be getting that would help us buy groceries, when do we look for that to come? My second question for WellSpan is, have you gotten any additional masks, or are you just depending on people making them and bringing them? For example, I made one out of the HEPA filter bags for vacuum cleaners.
That's a pretty ingenious. I think that's a great innovation on your part there, Pat. Let me start out with the check. It's my understanding that they hope to have that out in this month of April. Of course, it's a pretty big lift to get on a turn on a dime and get checks out to virtually almost every single American in one form or another. But it seems like things are moving along very quickly. In 5 days, they implemented this system for unemployment and for loans for small businesses. So I expect that when I say within the month, that what I'm talking about is April. And if you can just keep track of our website or Facebook or however, even if you got to call our office, we'll give you updates as we refine, as that's refined and we know more specifically, so that you can expect it and plan on it. On the other one, I guess I'll turn to Dr. Godecker on the mask issue.
Yeah, so Pat, that was I think one of the more ingenious versions. I don't know if that's something you had found on the internet. Where we are with masks at WellSpan, and I think all our healthcare systems are running into the same problem, is that there are critical shortages all over the nation. And so we have instituted a lot of different methods at WellSpan to try to not only conserve masks, but to try to increase production. We actually have a team, we call them the MacGyver team, that they are creating masks for our staff So they have been working on that now for about 2 weeks. We have supply chain people that are scouring the country and the world to try to get masks. We are actually also repurposing masks. So we have a process now where if we have a mask that was used by one of our staff, that we have a way of sterilizing it so then it can be used again by that staff member. So lots of things going on. Now, in terms of our patients coming in and trying to protect them and provide them masks, we still have some available for our patients when they come into our offices, and we are handing them out to protect our patients. The one thing that can really help us out and all the health systems out, that if you have your own mask like you did, definitely wear that and bring that into your appointment if you are coming into our healthcare facilities. So that will help us a lot because it allows us to save those masks for our healthcare workers.
Pat, I want to add a couple of things just from the legislative and policy perspective. I think it's a great question. And I just, in case folks that are listening don't know, we have relied very heavily on China, unfortunately, for a very long time for these type of items, whether it's personal protective equipment or pharmaceuticals, et cetera. And of course, in this circumstance, that has proven very, very problematic for us and the ability to supply. However, there is a national stockpile, so we keep this stuff on hand for events like this. And while WellSpan may still be experiencing some, I don't know if I'd call them difficulty, but maybe the doctor would characterize it that way. One of the reasons would be is that even though there is a stockpile, including in Pennsylvania, it would go to the areas that need it first or need it the most. And so the good news is that while WellSpan might not have exactly as much as they want to be comfortable, one of the reasons is it's going to other places, including other places in Pennsylvania, because there's a greater need there immediately. And so that's good for us at this time right here in central Pennsylvania because we don't have that overarching need that other places do. That's number one. Number two, you got folks like you that are ingenious in making your own and producing out of different materials, and I think that's wonderful. It's also great to know that we have businesses right here in our local community that have been shut down because of the virus and because of the economic conditions and their current competition with China, who are now repurposed their industry and are actually making mass surgical gowns, surgical equipment, so on and so forth. So that's number three. Number four, they are producing now and distributing machines to clean the mask, as Dr. Godecker mentioned, but actually as a methodology to repurpose them or reuse them on multiple occasions, thereby extending the stock. And so there's actually a machine that is used to do that, and the federal government has purchased a pile of these things. And again, they're going initially to most afflicted areas, and then they'll be distributed as necessary. And then finally, of course, on the president's call today, this is a point of focus for the administration to bring manufacturing of these very items home to the United States of America and make it cost effective so that we can compete through various ways with our competitors in these countries that produce at very low rates of cost because of the lack of labor restrictions or requirements, environmental, et cetera. So there's a lot of good news regarding that conversation, and we just need to look at all of it and see what we can do now. But we are keenly aware, I will tell you, at the state and the federal level of the challenges that Dr. Godecker and the similar healthcare outlets in the region and across the Commonwealth are facing, and we feel like we're fairly well prepared to handle them. It's not perfect, but we're going to have what we need when we need it, and that's the point. So thank you for a great question, Pat. Laura, do we have another one?
The next question comes from Robert B.
Hey, Robert, what's your question?
Hello. Yeah, something that's kind of been bothering me is you always hear about people that are asymptomatic without symptoms and that they're carriers. So do these people eventually get sick with mild stuff or go on to serious, or do they stay asymptomatic forever and be carriers forever, or how does that work?
Go ahead, Dr. Godecker.
Yeah, Robert, that's another great question, and I probably shouldn't use the term asymptomatic, and I apologize about that. Most people have mild symptoms, and there are some signs. So people will have usually cough or fever, maybe just for a few short days, and then they recover. The key is right now, if you have those symptoms, if you have fever, if you have cough, if you have shortness of breath, you have to assume that it is from the coronavirus. And in that situation, the best thing that you can do is stay away from other people so you do not spread the virus and you don't infect people. Most people, like we said, do recover and they don't go on and get more significant symptoms. So people that do get better, they usually stay better and they do not get sick again. There is that small group of people that their symptoms will continue to get worse or they won't quite get better, and that's when they need to seek health care, talk to their doctor, maybe get tested, or even need to be admitted to the hospital at some point.
Well, thank you, Robert. And while everybody's pressing star 3 to get a question in, one for Nick I have is I think that in some of your stores, or maybe it's across your entire operation, you've implemented a limit of 2 on some key categories throughout the store. So that would mean that people that come in, they would get 2 of one, any single item, but it would be reserved to 2 so that other folks could then have an opportunity to get 2 as well. Can you kind of inform us of what that would include? What items might have that, if you want to call them restrictions on them?
Sure, it's a good question. We have been changing as supply gets even stronger. So as an example, we did have to have one temporarily in the poultry category. So if you want a chicken, but now that has rebounded because of great companies like Bell & Evans and others. So we're in good shape there. A new one that we just implemented this week is on distilled water. People were, you need that if you're using it for medical equipment at home often, especially for kids and other things. And people were just taking a bit too much, and so we had to implement a limit on those, just to 2 gallons or 2 boxes if you get those packs. And so it's items like that, cleaning items, paper goods, toilet paper and things, whenever those come in. That's an immediate one because that one is one that, again, people just still don't have enough of and are going after. But it's flexible. There's a few from the office, and then our store managers are empowered. If there's something local that makes sense for their particular store, they're empowered to do the same thing.
So if you do have a question about it or a particular need or what have you, you can talk to the folks right at the store and get that resolved. Is that right?
Yeah, that's right. We've communicated really clearly on the shelf edge, so it's right there. And then if there's a question, any of our management team can help out. I should also say, if you're ordering online, you'll notice that immediately because we have limits right on the ordering form at our Giant Direct website or on the application itself. So you'll notice those there as well. Okay,
thank you. Laura, do we have another question?
Our next question is from Barbara H.
Hey, Barbara. Barbara, are you there?
Yes, my question is, when the shelves in the stores are restocked, what precautions are taken then where the stockers touch everything, or do they wear rubber gloves, or how are we protected there?
Go ahead, Nick.
I missed the first part of it. I'm sorry, my phone cut out. Can you repeat it, ma'am?
I said, what precautions are taken when they restock the shelves with goods? Or do they wear rubber gloves, or is there something, or how is that handled that we don't pick up something by just picking up an item and putting it in our basket?
Yeah, I got you. It's a great question. We're actually sanitizing shelves in the evening. That's one of the reasons that we're closing early. And as shelves sell down, we're going through and cleaning those out as much as possible. And then many of our teammates are wearing gloves if they want to do that. We're also doing aisle blocking, which is another thing that just keeps people from coming in and touching it during that cleaning process, so that you can't actually come in, and also to protect people from kind of bumping up against each other. It does not take away the need to wash hands regularly, whether you're a teammate, a vendor, or a customer. And, certainly many people are wearing masks and gloves themselves, even as customers, and we encourage that, in line with what the governor and CDC and everyone else has been saying.
Hey, this might be a follow-on question for you, Nick, and Dr. Godecker. Is the packaging, because we know that the virus lives on different materials, cloth, hard surfaces, et cetera. What's the vulnerability of the packaging of the food, whether it's a box or a bag or a foil wrapper or something like that? And then what about, does the virus live in the frozen or cooler section? Does that make a difference? Either one of you at this, why don't you start, Nick, and then we'll see what the doc has to say.
Yeah, well, we're assuming that the virus can be anywhere, and that's why we've done so much extra cleaning right now. Just as an example, every hour, all of the touch devices, like the pin pads, if you're using a credit card, are wiped down, and then the cash registers are wiped down, and the door surfaces, and then the restroom. So we have this enhanced cleaning protocol for anywhere that's kind of high traffic, and then we've also shut down areas where somebody might want to dwell. So as an example, like the salad bar or the olive bar, the Mediterranean spots, any of the hot foods, those areas where people would kind of congregate or wait and touch a lot of things, we've temporarily shut those down and just, packaged everything that we can so that customers can take them. So for us, we're pretending like it could be anywhere and just doing everything we can to keep safe.
What do you think, Dr. Godecker?
Yeah, Congressman Perry, it's, I think understanding how the virus gets spread, and one of the big ways is in droplets from people coughing and sneezing. And so just that, we talk about the mask, but that's why the mask is so important. You're not necessarily protecting yourself, but you are definitely protecting other people when you cough, when you sneeze, if you have the infection and you might not know it, and those droplets get spread. It does live on surfaces. There's been different studies that have shown different amounts of time. I think the important thing to realize with that is that when you're out in a public area, or if you, such as a grocery store, and you pick up items, then it's after you're done or after you've shopped, definitely go ahead, clean your hands with alcohol cleaner, wash your hands, whatever the easiest is, especially if you're going to eat or need to touch your face, things like that. In terms of the frozen section, that's a great question. I don't know that answer for certain, but I would treat any surface as a potential place where the virus could live. This is a virus that we know can spread fairly easily, and because of that, I would be careful with that. So that would be my advice on that.
Yeah, that's what I understood. Don't assume just because it's in the freezer or the cooler that kills the virus and it makes it any more safe, that packaging there. So that's what I understood, but I didn't know if you had any more. Appreciate it. Laura, do we have another question?
The next question is from Dennis E.
Hey, Dennis.
I don't remember asking my name.
Hey, Dennis, are you there? Dennis, you can ask a question if your line's open, if you have one. Okay, go ahead.
Hello?
Yes. Is this Denise or Dennis? Laura, I don't know. I think maybe they're not paying attention.
Yeah, we'll move to the next question. Our next question is from Darlene I.
Hey, Darlene.
Hi, I just wanted to find out because I went to Giant this morning during the senior hour, and it was really crowded, so that got me kind of nervous. And the carts were outside, and I wasn't sure whether the carts had been cleaned or what. So I just wanted to find out, is there a better time to go even outside of that senior hour where it's not so crowded?
Go ahead, Nick.
Yeah, the senior hour has been popular, especially once we added in the pharmacy opening early as well, particularly on a Wednesday. So I would say that the slowest time, if you were wanting to go when there was the fewest amount of people right now, is in the evening hours. So anytime kind of after 6 p.m., you're not going to see as many people out and about, which is odd because that's different than it was, pre-corona, we would say. So shopping patterns have definitely changed while everyone has been kind of sheltering in place. As to the carts, we're cleaning those multiple times a day. And so you should have been in good shape there. But again, I just encourage mask and gloves right now, just in an abundance of caution for everyone.
Thank you. Thanks, Doc. Darlene, thank you. I hope that answers your question. Laura, do we have another question?
The next question is from Holly.
Go ahead, Holly.
Hello, how are you?
We are doing
Hello?
well, thank you. I hope you're well. I hope you're well. Yeah, we are good.
I'm hanging in there. My question is the self-employment, getting help. I have a cleaning company. It's just me and my husband. And we have been out of work for 3 weeks because people are canceling. And it's not essential. When do you expect possibly self-employment to get help?
Well, the self-employment component of the CARES Act is supposed to be live this Friday. Now, my concern is that in part it works in conjunction with the state unemployment compensation because, as you know, Holly, self-employed individuals, sole proprietors, contractors, et cetera, in the past could not collect uninsurance or unemployment compensation. And now that has been modified solely for this event. The federal government is going to be reimbursing the states for that, but I think that the federal government was hoping to use the state's system to kind of mete out the unemployment compensation to individuals, to use that backbone so they didn't have to create a whole new one. Unfortunately, the states weren't necessarily completely prepared for that. And so my understanding as of yesterday, from what I got from the Department of Labor, you will be able to apply this Friday, assuming that the state is also prepared. And I would just encourage you, unfortunately, to do two things. You can either check with us on a regular basis, or you can check with the Department of Labor. That's the Federal Department of Labor website, and they will give you updates. It also would not hurt just to check in with the regular Commonwealth Unemployment Compensation Bureau. My concern is that there has been a rumor, and I have not been able to confirm it, that once you sign up for unemployment compensation benefits under the state, if you were not previously eligible, i.e., you're a private, you're a sole, what the heck am I? You're a contractor, or you're independently self-employed, et cetera, that would mitigate or negate your ability to collect from the federal program. I'm hoping that's not the case and that we don't have to fix that if it is the case. So at this point, again, Friday is your goal, is what you're looking for. That's when we're supposed to be able to go to the portal, to the website, and make your application. I would just encourage you to check with the Department of Labor and keep up to date with them. You can also use our office as well, and or the State Unemployment Compensation Bureau. I'm sorry, I don't have a better, more definitive answer for you. This was 5 days to get small business going, and then 10 days to get everybody else included. And I think they've done, had some glitches on the small business end with the SBA, the Small Business Administration, and the loans and so on and so forth. I'm sure there are going to be some glitches as each state comes online on the unemployment compensation, but I'm confident they will. And just need everybody to be patient. I know it's very difficult. Know that we understand your situation. I used to be a sole proprietor and a business owner myself. So my heart and my concern goes out to you very sincerely, and we are working diligently to make sure it works. And so if you do experience problems on Friday, I want you to contact our office and just so that we can advocate and know exactly what those challenges are and work to fix them. But that's what we're looking for this Friday. So, but I do encourage you very much to check with the Department of Labor, the Federal Department of Labor, that website, and just continue to monitor that. As I said, we got information yesterday about the program and how it's going to be conducted, and right now it's my understanding that we're waiting on the Commonwealth of Pennsylvania's Unemployment Compensation Bureau to come online to facilitate that. Wish I had a better answer for you, Holly, but that's what I have at this point. Thank you. I'm sure there's a lot of other folks listening who have the same question. Laura, do we have another question?
The next question is from Sarah G.
Hey, Sarah.
Hello?
Hello, Sarah. You're on. Go ahead.
Oh, okay. My question to you is, I have some masses that were left behind my husband when he passed away. And I tried to give them back, but he had bought them so they wouldn't take them back. But they're packaged off and everything. But they were they're breathing masses with the hoses. They're all, bagged up and everything. And I was once told to go on eBay. But that's not my concern about eBay. But I don't know if I could get in touch with the hospital to pick it up because it might be needed because I have a machine. I don't know what to do with that.
Great question, Dr. Godecker. Can you help Sarah out here a little bit?
Yeah, Sarah. What I would say with that is that you can contact that phone number I gave, the 855-851-3641, and ask them. Sometimes there are certain pieces of medical equipment we cannot take back. There's the same with medicines once they've been dispensed. What I can tell you, though, is that we are trying trying as much as possible to look for opportunities like that to be able to reuse things that are safe, that we can safely reuse in situations. So I would go ahead and say contact that information, that hotline, and they can provide you more information on that.
Hey, Dr. Decker, can you give that number again slowly and just say again what people are calling when they call that hotline? What's that for?
Yeah, so that we have it's called the Coronavirus Information Hotline, and that phone number can do multiple things, and I'll talk about that in a second. The number it's a 1-800 number. It's 1-855-851-3641, and that number can be used if you have questions about coronavirus, if you have questions about an exposure, or if you have questions if somebody should be tested. We have nurses that are handling those calls. I believe it's operating from 7 a.m. to 7 p.m. daily. And so those you can call in. In that phone number, if you select option 4, so if you have a donation that you would want to make to the health system, you would want to select option 4, and they would then, that's how that information can get to us. So once again, it's 855-851-3641, and it is a toll-free number.
Great. Thanks, Doctor. Laura, do we have another question?
We do. The next question is from Jordan D.
Hey, Jordan, you're on the call here. What's on your mind? Jordan, are you out there? I think Jordan must be gone, Laura. Do we have another question?
Sounds like it. The next question is from Amelia A.
Hey, Amelia, what's on your mind?
Hi. I just wanted to know if there's any truth to the rumor about ibuprofen potentiating the virus.
Great question. Go ahead, Doc.
Yes, Amelia. So I'm glad you asked that. And so right now, the recommendation that's come from the World Health Organization and from the CDC is that if you do have the infection, the coronavirus, if you've been told that you have it, that you would not take ibuprofen. for things like pain or fever. So you can use Tylenol or products with Tylenol, the generic name being acetaminophen, for that. What I can tell you about that is that the risk is what we call theoretical, so we haven't proven that it's an actual risk, but there is enough there that they said, you know what, we should be careful. So we have made the recommendation to all of our physicians and our nurses out there that when advising patients that if they do have coronavirus, or if you suspect that you have it, so if you have those a fever, a cough, a shortness of breath, that you would stay away from ibuprofen. But that's a wonderful question.
Hey, and Nick, can you talk about that, about ibuprofen as opposed to, say, Tylenol on your store shelves and availability?
Yeah, the national brands are coming back a bit faster than the private brands, so the store brand items are in most cases. And so the store that I was in yesterday, that's what I saw. Both are on the way, but there seems to be more right now of national brand.
But they are available. I know that sometimes, when that information regarding ibuprofen came out, it seemed like there was almost you couldn't find Tylenol.
The store I was in yesterday did, but things change very quickly, and as said, as soon as something is mentioned socially or anywhere else, people may flock to it. So it's probably a category where we will, if we don't already have the limits up, we'll be adding that.
All right, thank you. Laura, do we have another question?
The next question is from Lynn F.
Hi, Lynn.
Hi. Thank you for doing this. My question is, I have a question for Scott Perry, but they said somebody from your office would call me. It's about a business that I own. So I'm looking forward to hearing from you. The question I have for the call is for the Giant gentleman. Is there any precaution you take with your workers on a regular basis to kind of make sure their health is okay, that they're not coming down with something, or, I don't know. I know the masks only can do so much, but I'm just wondering if there's a regular thing that you do to make sure that they're healthy when they come to work.
Yeah, I'm glad that you asked that. We've done everything that we can to make sure that if they're not healthy, they don't feel the need to come to work. And we have a really strong benefit package already in place anyway. We've enhanced that in areas wherever somebody has had either exposure to somebody who is COVID positive, or they themselves may think that they're symptomatic, just to try and take care of them the best that we can. But it really starts with conversations at the beginning of the shift, at the end of the shift, to make sure that everybody is in a good spot. And I see absenteeism reports every day, and I'm happy that they are higher, because I think that means that our teammates, feel like they have the flexibility to be away if they need to right now.
Yeah. And Lynn, I'm going to weigh. This is Dr. Godecker. I'm going to weigh in on that too. For the health system, and I believe all of the local health systems have instituted this, because we don't want to have our healthcare workers spread the disease to our patients. That would be the worst thing that we could do. And so when our healthcare workers come into work, we ask them to put their mask on. As soon as they get out of the car, they are screened before they come into our hospitals or any of our offices. They are asked questions, and we are attempting to take temperatures at all of our facilities of all of our healthcare workers to make sure. And we are telling them, do not come to work if you are sick. So don't even come in. Don't try to be a hero. We will cover this. And as Nick said, we have a benefit package to try to support our staff.
Lynn, thanks. Well, Lynn, thanks for the question. I think that those answers give us a pretty darn high degree of confidence, not only about our healthcare workers and facilities, but also about Giant and what they provide, knowing that we can go, get our groceries and feel pretty darn safe and secure that we're not going to get sick from going there. So thank you for that. Laura, do we have another question?
The next question is from Laura M.
Hey, Laura. Laura, are you there? I think Laura is either not listening or what have you. Do we have another question, Laura?
Sounds like it. Our next question is from Bill B.
Hey, Bill, your line's open.
Yes, sir. Thank you for taking my call. My question was, the place where I'm employed has slowed down because of the coronavirus and having to shut part of our operations down and so forth. And so my hours have been cut from full-time 8 hours to 3 hours a day. Is there a partial unemployment you can apply for or for that situation?
Bill, there is, and I would just encourage you to go ahead as soon as you're able and contact your state unemployment compensation office and tell them your circumstances and go ahead and apply. And also, it's my understanding, based on the bill that we passed, that you will be able to avail yourself to the federal component as well, even though you're partially working, that will invoke the federal component as well. So you will collect not only from the state at this point, but from the additional funds made by the federal government. So I would just encourage you to go ahead and contact the State Unemployment Compensation Bureau. And again, if you have any concerns about that or further questions, please give us a call, and we will assist you as best we can. But you will start at the state level, and you at this point should not wait any further to go ahead and apply. Great question, Bill, and I'm sure others are in the same boat. And while I wish you were working full time, it's at least you're getting a few hours, and I think that is helpful for everybody. So I think that's good news there in light of things. But Laura, do we have another question?
The next question is from Jennifer B.
Hey, Jennifer, are you on the line?
Yes, I am. Hi.
Yes, ma'am. Go ahead.
I just want to thank you all for being there. My question is for Nick. I want to know if, since our governor has put out a directive that when we are out, we wear masks. I was in the Dover Giant the other day, and some of the staff had masks on and some of them didn't. And, you know, I'm a nurse, and, you know, you all had talked earlier about from a standpoint from, you know, to protect the staff at Giant and to protect the shoppers, you know, God bless the staff at Giant for being there. And, you know, the plastic protectors are excellent for the staff. I was concerned because they didn't all have masks on, and I don't even want to get started on everybody in the store who was shopping who didn't have masks on, because again, that would put the staff at risk who are working there. Do you have any guidelines of asking them to wear masks? Do you have masks available to them? I saw some with homemade masks and some with cloth masks, but one of the girls had it below her nose, so it wasn't effective at all.
Yeah, I appreciate the question, and I hear that you're a nurse, so thank you for what you're doing. Also, we've definitely followed the governor's recommendation. I mean, my family has, I have, and anyone who has access to masks have done that. We relaxed our policy several weeks ago before the governor mentioned it to allow anyone who wanted to wear a mask to do so. And then the ones that we actually had, we prioritized to our pharmacists. We have many immunopharmacists, and so as they're doing immunizations or having close contact with patients, we felt like that was the most important place to begin with our very, very limited supply of masks. And we then went out and sourced actual plastic shielding that just came out, I think this week. We finally got the shipment in. And so we knew that they're just, you know, the priority actually was for healthcare, and our sourcing team was unable to find a lot at the beginning. Thankfully, there's millions on the way, and we've sourced those. We just got another shipment in, I'm told, last night, that's now being distributed out for our associates, for our teammates rather, and going out there. So it's a complicated answer in that no, we don't have them yet. Yes, we are trying our very best to get them for all of our teammates. 33,000 teammates, and trying to follow the guidance on changing those. Some of the best way has been what you mentioned, which was people making them themselves or bringing things in themselves. And that's the other reason that we put up the plexiglass shields and did as much social distance enforcement, with the signage, with the overhead PAs, with the social media, activating all the apps and everything else. So probably a longer answer than you asked for, but I'm with you. I think it's a good thing to do, and we're doing everything we can to provide for our teammates.
Man, thanks so much for the question. And you can tell that Nick Giant is doing everything they can to keep their folks and us safe. We sure appreciate your service as a nurse, and for Nick, making sense of some of this stuff that, looks inconsistent or maybe different to us, and why it is that way. There is a good reason why these things happen, and we sure appreciate your input to help us make sense of it so we don't question so much and we can figure out other things that are important to us. Laura, do we have another question?
The next question is from Gail L.
Hey, Gail, are you on the line?
Yes. Hi. Thank you very much for taking my call. I am at home. My question is, I've been housebound for 3 weeks with no outside people coming in or out. Can I assume that I am corona-free?
Go ahead,
yes,
Doc.
Gail.
I think.
Yep. I can take that one. So Gail, thank you for staying at home. Being housebound for 3 weeks, what we usually recommend is a 2-week period. If you have no symptoms in a 2-week period, or you do not develop symptoms, then we can assume that you are coronavirus free, COVID free. And so in your situation that you've been home 3 weeks, if you don't have any symptoms, then at this point we would assume that you would not have any infection right now.
Great question, Gail. Laura, do we have another question?
Our next question comes from Leroy V.
Hey, Leroy.
Hi. My question is for the doctor. Now, I haven't heard much lately on blood donations. Are we still accepting blood donations? And how does that affect with the virus transmission?
Yeah, so great question, Leroy. We are still absolutely accepting blood donations. What happened when the shelter-in-place came in, there was a dramatic drop in blood donations, as you would expect, because people weren't going out. The community blood donation events were being canceled. What we have been working on with the Central Pennsylvania Blood Bank is trying to get safe blood drives up and going again, so where we can keep social distancing, where we can allow people to come in and give. Obviously, people, when they come in to give, they will be screened for symptoms. So we will ask if they have cough, if they have fever, if they have shortness of breath. In those situations, they would not be allowed to donate, or if you have an active fever at the time of donation. And we want to make the blood supply obviously safe. But yes, that is one of the things that you can definitely do. Contact the Central Pennsylvania Blood Bank, and they will be able to direct you to a location in York. I know our blood donor center down at Apple Hill Medical Center is open, so you can contact them, and they will have you come in and keep you safe while you're there.
Hey, Leroy, thank you. That's a great question, because there still is always a continual great need for blood donations even throughout this crisis. So I think that's a really operative question. And Doc, we sure appreciate the answer, because we still have to fulfill that need on a regular basis. And so I think that's critical. Laura, do we have another question?
Yes. Our last question will be from David B.
Hey, David, what's on your mind?
Hey. Hello, Congressman. How are you?
I'm well, sir. What can we do for you?
Question for you. One is your offices still able to be contacted at the same numbers pre-pandemic? And also, would they have the ability to provide information or summaries on the 3 bills that passed with regard to federal legislation and response to the COVID? Thank you.
Yes, sir. Thanks so much for the call. Our offices are open. Quite honestly, we're 24/7 now, so we're probably open more than we ever have been before. So you can just call the same number. It's you're gonna be connected to one of our staff members, and we're gonna deal with and handle whatever your issue. And of course, we can provide summaries or the bill language, whatever you need regarding the pieces of legislation and the things that they dealt with, the amounts of funding to different organizations. All that stuff can be provided upon request. And so we are here continuously ready to serve whatever your needs are. And David, I sure appreciate the question and the opportunity. This is the time when I think that elected leaders really need to rise to the occasion and be available to make sure that that our bosses' needs are addressed succinctly and judiciously. And I'm just letting you know that all our staff is working essentially around the clock. And so thank you for that. Well, listen, that was apparently the final call for this hour. I want to thank everybody for their participation. Dr. Godecker, can you go ahead one more time and give that toll-free number for the hotline? Can you do that for us one more time?
Yes, and Congressman Perry, I want to thank you for inviting me on and allowing me to answer questions tonight. I want to thank all of the callers, wonderful questions. The phone number, just so everybody has that again, it's the Coronavirus Information Hotline. It's toll-free at 855-851-3641. And I really want to emphasize the fact that please listen to our state officials, our federal officials, stay at home, honor the shelter in place. We want to be really careful. We want to try to slow the spread of this disease so our healthcare systems and our hospitals can handle it and take care of the people that need to be taken care of. But thank you.
And thank you for that. And Nick Bertram of the Giant Company, can you want to just give the website for people so if they have questions, they can immediately get those answered regarding what they can find at your store and the different options that are available to them?
Absolutely. It's giantfoodstores.com. One of the probably the best way, though, is just to get in touch with us on social media. Most people, we have a team of 4 that are answering comments and questions on Facebook, Twitter, Instagram, every single day. And so that's another way to get the information out there. And I just want to thank you, Congressman, for inviting us, and wish you well as you continue to fight for all of us.
Well, I appreciate it. Dr. Godecker and Nick Bertram, we sure appreciate your time and your expertise and being on the front lines. Each of you are providing critical services at this time, and we sure are appreciative. We are appreciative of your time and for being here to answer tough questions today. And to my bosses, my constituents, thanks so much for your participation. I would just encourage you once again to stay in contact with us on our website or through Facebook, or certainly call the office. There's a lot of information that changes on a pretty regular basis. So, just check in on a regular basis, whether it's for the Department of Labor or, quite honestly, we will take information from Dr. Godecker if he has it from us, and we'll impart that to you, as well as Giant Food Stores. If they have information, you can, and they'll give it to us, and we'll make sure that you get it as things kind of change and requirements change, or we learn more about what we should and should not do. So I want to thank everybody so much for taking the time on this call, and just stay tuned. We're going to do some more of this and provide more information to you. And until then, I just hope that everybody has a wonderful Easter holiday and that everybody stays safe and healthy. Thank you and goodbye. God bless you.